Hello, everyone, and welcome to our September Caregiver Chat. We're going to give everyone just a few seconds to log in here on Zoom. I know we're also broadcasting out on our Facebook group. We're doing a Facebook Live, but we're so grateful that you've joined us for the Caregiver Chats. My name is Lakelyn Hogan. I'm Home Instead's gerontologist and caregiver advocate. I'm joined today by two experts in the space of dementia and home care, and I'll get to them in just a moment to formally introduce them. But again, welcome. This is part of Home Instead's Caregiver Chat series. We each month pick a topic on caregiving, and we source a local or national expert on the topic, and we have a conversation, and then we open it up live for questions. So we're so glad that you're here. We also record these chats and put them back out so that you can share them or rewatch them. And again, we'll be taking your questions throughout the chat, so we encourage you to participate. Share your questions at any time. On Zoom, you can do so through the Q&A box and the chat function, and on Facebook, you can just comment on this chat, and we'll get to as many of the questions as we possibly can. But this month's chat is focused on dementia and dementia home care because September is World Alzheimer's Month. So Alzheimer's Disease International, it's a wonderful organization. ADI is the abbreviation. They're sharing resources this month to raise awareness, to challenge the stigmas of dementia, and then also to call for dementia to be a global health priority. We know that dementia, it's taking place in the lives, or it's impacting the lives of people in the US, but also globally. And so ADI is working to, again, raise awareness. And so we wanted to bring forth a dementia-related topic this month to our chat series. And we're going to be focusing today on the ins and outs of dementia care, dementia home care. And so the subject of home care or respite care can bring about a lot of questions for some family caregivers. They might be asking or wondering, how does it work? What does it cost? What are the benefits? And then when you layer on a diagnosis of Alzheimer's and dementia, and you're watching your loved one have maybe some dementia-related behaviors, and you're facing some challenges, you might be wondering, are these professionals that we invite into the home, are they trained in dementia care? Can they provide the level of care that my loved one needs? Does this chronic condition, this Alzheimer's and dementia care, does it make the care more costly? So those might all be questions that are circling around in your mind, and we hope to address those questions and more in today's chats. They can be heavy questions, and it can be kind of overwhelming at times to find all the answers. You're a busy caregiver, and then you're trying to source out all this information. So we hope, again, today we can provide as much information as possible to really help you better understand the ins and outs of dementia home care. And today I'm joined by two experts in this field, Kremer, the Executive Director of LEAD Coalition, and Bonnie Wattles, the Executive Director of HFC. So I'm excited to introduce them both to you now. Kremer is the Executive Director of the LEAD Coalition, and he's a nationally recognized public policy expert in Alzheimer's disease and other forms of dementia. The LEAD Coalition has helped to build a nationwide network of dementia-friendly communities, improve dementia detection and diagnosis, combat elder abuse, and secure historic federal funding increases for dementia research, care, and supportive services. Ian participates on steering committees for numerous research studies and national projects supporting those living with Alzheimer's and their caregivers. And then Bonnie Wattles is the Executive Director of HSC, formerly known as Hilarity for Charity. With over 20 years of business and nonprofit leadership experience, Bonnie is bringing HFC into the next growth phase to become a leading voice in brain health awareness and care for families impacted by Alzheimer's disease. HFC is a national nonprofit organization founded by Seth Rogen and Lauren Miller Rogen, and their mission is to care for families impacted by Alzheimer's disease, to inspire the next generation of Alzheimer's advocates, and to be leaders in brain health research and education. Both of you are doing such incredible work. I appreciate you taking the time to join me today, and welcome. Thanks for being here.
Thank you for having us.
Well, the pleasure is all mine. And so I know we're going to dive into today's topic. And I thought we would start first. I know I shared a little bit about your bios, but I thought we could start by having you just tell us a little more about your organization, because you are doing so much great work in the space of Alzheimer's disease and caregiving and support of families. So Ian, would you mind telling us first a little bit about LEAD Coalition?
Sure. And Lakelyn, thank you for all the work that you and Home Instead do for families like mine. The LEAD Coalition has been around for a little more than 10 years. I've been there for about 9, and I've been working in Alzheimer's and dementia policy for almost 25 years. Come November, it'll mark that anniversary. And I will just say up front, when I started doing this work 25 years ago, I never imagined we wouldn't have ended Alzheimer's and other forms of dementia by now. So I was a little naive, and I've learned a lot of hard lessons along the way. But with organizations like Home Instead, HFC, the partners in you're both member organizations in the LEAD Coalition, along with over 100 other organizations, we lift each other up and we try to help reach that end of Alzheimer's and that end of all forms of dementia. But in the meantime, make sure we're doing whatever we can to improve quality of life for people for whom those cures will come, frankly, too late. And the cures have come too late for 2 of my family members, a grandparent on each side. They're looking like they'll probably come too late for another family member who's currently struggling with some cognitive impairment. But we will get there. Science inexorably moves toward the end of Alzheimer's. And our job as advocates for federal policy and for better science is to make those leaps forward, not crawl forward, but leap forward and get us to the end of Alzheimer's sooner. And in the meantime, radically transform quality of life for those who are facing the disease. And I'll just end on this and say that part of that science, it's partly biomedical. It's coming up with drug therapies and other interventions. Part of it is also care intervention science. Part of it is also brain health promotion science. Those are equal parts science. And we have to advocate for all of it, and we have to make sure all of it moves faster, bigger, bolder toward the outcomes that matter to real families like those that we know personally and for our own loved ones.
Thank you so much, Ian, for sharing that. I agree that all the things that you just mentioned are so important, and the research on finding a cure is important. But I love that you said also research around the care and support, and one of those supports that we're going to be talking about today is respite and home care, but then also about brain health. And I know, Bonnie, your organization has a big focus on that, so I'll let you tell us a little bit more about HFC and all of the great work you are doing in your organization.
Great. Well, I echo Ian's thanks to Home Instead, and your organization, Lakelyn, has been such a terrific partner with HFC from the very beginning. In 2012, HFC was founded by, as you had mentioned, Seth Rogen and Lauren Miller Rogen, and that was shortly after Lauren's mom had been diagnosed with early onset when her mom was 55 and Lauren was just 25. And she felt so alone as a young person in her 20s. And so they decided to host their first variety show to help, face their grief. And through that effort, they realized that they weren't alone, and they realized they really had a platform with so many other young people whose families were impacted by Alzheimer's. And with the funds that they raised, Lauren and Seth really wanted to help families in a very tangible way. And one way we do that is through our Respite Care program, which we do in partnership with you all at Home Instead. We run online support groups and also provide brain health education. And so fast forward 10 years later, we are a national nonprofit organization. To date, we've awarded over 350,000 hours of in-home respite care. Again, we run online support groups. We have caregiver wellness webinars. We host large-scale, celebrity-studded, really fun and innovative events. And we also have a strong focus on brain health education. And it's because we feel that we have such a strong voice with young people. And the way we feel we can impact the space is by having people start early on their brain health journey. And using lifestyle interventions at the youngest of ages in high school and college to live a brain healthy life so that we can really prevent this disease in the future. We know now science is telling us that 4 in 10 cases are preventable through living a brain healthy life. So thank you.
Well, thank you for sharing more. And again, the work that both of your organizations do is so important. And we were talking right before we came live on the chat about how the Alzheimer's space, there's so many great partners working together to reach our end goal of a cure, but also supporting those who need care. Our CEO always says, until there's a cure, there's care, and people really do need care and support. And so today we are talking about home care and respite. Because we know that people often want to stay at home. For those living with cognitive impairment, those living with Alzheimer's and dementia, often home is a familiar and comforting surrounding for them to be in. We know it's not possible for everyone with Alzheimer's and dementia to stay at home, throughout their entire disease process. But if we can keep them home as long as possible, that's usually the best case scenario. And so home care is one way that we can support caregivers as they support their loved ones. And the way home care can support the individual living with dementia is by doing things like helping to engage them in meaningful activities, helping to provide support for their activities of daily living, bathing, grooming, incontinence. Because sometimes that can become overwhelming for families, or caregivers might just need a little break. That's what the word kind of respite means, is a break from the caregiving role. And I think a lot of times people, they know what home health is, having a physical therapist or occupational therapist come to the home. They are kind of familiar with that term, but not everyone knows that home care is an option and that it is available. So we're going to be talking more about home care today. And often this care is provided by a trained professional caregiver. And of course, family caregivers, they do so much for their loved ones, but sometimes, again, they just need that break or that extra support that home care can provide. And Ian, I know you've had a personal experience using home care, and I know families often wonder, how it works. So would you mind kind of sharing how your family kind of got the process started and walk us through how you've utilized care for your loved ones?
Sure. And in fact, we've used it twice within recent years. My mother-in-law, who did not have cognitive impairment, but had ALS, Lou Gehrig's disease is how most people have heard of it. As her disease progressed, she was eventually essentially confined to a wheelchair, but in her own home. And a home care aide was both those sort of practical supports that you mentioned, a little assistance with cooking, a little assistance with cleaning, a little assistance with some other things around the house, but more important than anything, companionship. It was someone to share her day with, who shared some common interests, who would watch garden documentaries with her and plan for modifications to my mother-in-law's own garden that my mother-in-law could no longer create in terms of doing the spade work, but she could create intellectually. But she needed a partner to help write down the instructions for the people, including my wife, who would come and do the actual garden work. And it was just someone, so she wouldn't be alone. She wouldn't just feel like it was an employee-employer relationship. It was a budding friendship. And my mother-in-law actually passed away quite suddenly before that relationship had fully blossomed, but it was well on its way. And it meant that in my mother-in-law's last months, she had a friend in her home for times when she couldn't leave her home. And she wasn't isolated. And for all the church friends and neighbors and community friends and family that would come and spend time, there were those other hours where she just needed someone who shared common interests, who shared common values, who could be a friend. And this person was a godsend for my mother-in-law and for the rest of us, knowing that we had that support, emotional as well as logistical, in the home with my mother-in-law whenever she needed it. And then as a counterpoint for my father, and thankfully we still have my father with us, and he's doing well in many respects, but he needed someone to handle much more the logistical side of things. in part because he has a number of physical disabilities, including vision and tremors and other things. He needed someone who could type emails for him and read emails for him. He could dictate what he wanted to say back. But my father is a former academic and wanted to be able to continue communicating on that intellectual level that his physical disabilities limited. And his home care aides, in addition to helping with things like, you mentioned food and bathing and around the house, could also help him remain intellectually engaged with his peers locally and internationally. So it was an enormous benefit while he was still able to live at home, and helped extend that period of time and really magnify his quality of life in a way that as a family, we could never have done alone.
Thank you, Ian, for sharing. I think it was interesting to hear both experiences that your family had. And I think that is one unique component to home care and the services that home care provides, is that it is personalized to that person, to their needs, to that family situation. Some might utilize the service more for that companionship, or some might use it more for that personalized hands-on care, bathing, grooming, that sort of thing. Or it can grow with the person as the needs grow. It can start as companionship and then, grow as someone progresses, perhaps through Alzheimer's or dementia, and works with them to meet their needs over time. And I think that another interesting point that you made, Ian, was that your family was helping your loved ones, but this was just another kind of person in that circle of care that kind of helps to complete that circle of care. We see that family members are busy. Most family members are working, maybe raising their own children, and so they do kind of need that extra support to come alongside them. And Bonnie, Ian, did you have something you wanted to add?
Yeah, just a very quick point. I apologize for monopolizing the time, but with my dad, it started out twice a week for 4 hours, each of those 2 days. And that's all he was willing to try, because he was resistant to the idea, but then he got more used to it and to value it more. And even though he wasn't looking for companionship, some of the aides who worked with him over time, including some young college students, he really loved that. And it became, even though I don't know that he ever would have said it this way, it became that added value of companionship as the number of hours that he needed and was willing to have grew. Eventually it was 24/7 care that he was getting. And some of those young aides were, for my dad, like his former college students. And he could teach them and mentor them and make introductions for them as they wanted to pursue their academic and professional careers.
How neat. How neat. I do think that the relationship that often forms between the professional caregiver and the individual they're caring for in the family, it's unique. It is a relationship-based business. At least that's our approach at Home Instead is, yes, we come in there to do some tasks, but it's really that conversation while we're doing that task, getting to know the person, especially when you're working with someone with cognitive impairment, getting to know their life story can really help provide even better person-centered care. That's the approach we take again at Home Instead, is making sure that the care we're providing is really personalized. So that's why that relationship becomes so important. So thank you again, Ian, for sharing your family's personal experience. And Bonnie, I know you at HFC, you see the impact of caregiving on those that are supporting their loved ones living with dementia. And when they have the opportunity to utilize respite, some time away from the caregiving role, they really see some benefits for the caregiver themselves. So would you mind sharing more about that?
Sure, absolutely. We definitely have seen significant impact that family caregivers enjoy as a result of the respite. And in fact, we are getting ready to release an impact report on World Alzheimer's Day, and I'm happy to share some of the insights that we have with you now. But essentially, what we found was that respite helps the family caregiver in 3 significant ways. One is meeting their day-to-day needs. Another is improving their own quality of life. And the third is improving the quality of care that they're then able to give to their loved one. in terms of meeting their own needs, when a person has respite, we found that they're using that time to tend to their own personal needs, whether it's running an errand. They also tend to their own medical care and their own financial needs. And in terms of proving their own life, we heard things like, I had some time to myself to decompress. I had some time to sit back and just breathe. And having somebody, from Home Instead or another respite service provider in the home really gives the caregiver a sense of relief, knowing that their loved one is being cared for in a professional way, and they know that their loved one is safe, so that they can have just that sort of mental and emotional release. We heard that 91% said that the respite care helped them manage their own stress, and 79% reported feeling more positive about their caregiving experience as a result of having the respite care. And in terms of improving the quality of care, we found that the care grant recipient, the caregiver said that they felt more physically and emotionally prepared to continue on the caregiving journey, and that when they were back to caregiving, they felt really more patient and more present. So there are so many benefits that the caregiver themselves can receive. And again, it's really just that, that time just to sit back and breathe and tend to their own self-care that's so important.
I think those are such interesting findings, Bonnie. Thank you for sharing that. And I look forward to reading that report on World Alzheimer's Day. And I did my dissertation on the use of in-home respite for dementia family caregivers. And I heard a lot of the same kind of responses from those that I surveyed. But we also did see some barriers. We know that, again, some people are hesitant to having someone in their home. And there are some considerations that, of course, families undertake when they invite a professional respite care provider, professional home care provider into their home. So Ian, I'd be curious to know from your family's perspective, what were some of those considerations, or maybe were there any concerns when you first looked into this type of service?
Yeah, well, I think every family's situation is going to be different. So to some extent, I'm going to try to speak in some generalities, but maybe with an example or two from my own family situation. Every family is going to have to think about cost, and every family is going to have to think about the interpersonal fit. And I'll say, with the agencies that we use to provide that respite or that home care, and in the case of Home Instead, certainly there was an opportunity to interview potential caregivers and have them come visit. And it wasn't just, to use my mother-in-law as an example, it wasn't just my wife and her sister interviewing the carer, the potential carer. It was that person coming to the home and meeting my mother-in-law and spending some time and seeing if there was a fit. And that was really valuable. And then there are also going to need to be discussions about kind of orienting the person who's going to provide that respite or that care. And again, just to give an example from my family, love my dad, great guy, very particular about a few things. And my dad, for as long as I can remember, makes this extremely intricate, detail-oriented, he's a former architect, so you know where that comes from, oatmeal for breakfast. It's not boil some water, pour in a packet. Oh my goodness. And I can't do it right. But we needed to make sure that we were going to have carers working with my dad, particularly when he needed more care, more hours of the day, including making breakfast for him, that would not only be able to do the task, but would be patient and would listen to him and respect him. And, those are kind of core values. It can't be task-oriented work. It has to be relationship-oriented service. And that's what worked for us. We found carers, respite providers, both as companies, but also as individuals who were going to respect forming a relationship and providing service. That's what then translates to quality of care. And for every family, figuring that out is going to be a little different. What can you afford? How many hours do you need? Who's the right fit? What particular tasks do you want provided And frankly, which tasks do you not want provided? And that you is both the family member that might be securing the services, but more important, it's the family member who's going to receive the services. So I'll end on this. I might have wanted my father to get assistance with certain things earlier than he wanted to, but it had to be his decision, his comfort level. I needed to respect that, but I also needed to make sure that the agency providing service to my dad would respect that, and that boundaries would be established, respected, maintained, and then we would nurture a level of trust where maybe that boundary could be moved mutually, not imposed on my father.
Thank you for sharing that, Ian. I think you raised so many great points. And when you are interviewing various providers, those are the types of questions that are important to ask. And it is good and okay to interview multiple providers. I encourage that. Of course, I work for Home Instead, but I encourage families to interview multiple companies because it is important to ask those questions and really understand, what is their approach to providing dementia care? Do they have training? What happens if you do start with one specific care provider and there's a personality clash or it's just not working out great? Can you ask for a replacement? And companies that you want to work with and that are accommodating to that will recognize that sometimes it takes a few matches before you get one that's just right and makes everyone comfortable. And Ian, I like what you said about establishing trust. That's one of our core values is our caregivers work to build that trust. And sometimes you do find the individuals a little hesitant to this type of service because it is really personal. And so I think making sure that the respite provider that you're working with has a good understanding of that is so important. So I think we've addressed a couple of those barriers, making sure that there's good trust established, finding a quality provider that you feel comfortable with. We know that sometimes having that stranger in the home can be a barrier. And Bonnie, I'm sure in your research and from what you've explored, you've probably come across a few more barriers. What would be some that you see most often?
Yeah, I would say what we see most often is, some hesitancy to reach out for help to begin with, right? So I would encourage families to think about bringing respite in the home, or at least doing the research around respite or any other kind of support earlier than you think you need it. Alzheimer's is such a unique condition. It requires, education about the disease and understanding how to work with somebody who may have some other side effects such as agitation or sundowning. And so we just find that caregivers feel very proud of the work they're doing and feel like they don't need to reach out for help, but they don't realize necessarily that the toll it is taking on them. So we recommend, reaching out either for a support group or, the Respite Care I think we talked about yesterday, there's online chat bots that you can do. That's a low point of entry that you can just go in and on Home Instead site, I believe you have a chat bot so you can see, sort of some introductory information about what it would be like or what's entailed in getting a person in the home to help. And so, and then again, as you all said, the patient definitely has their preference in caregiver, as does the caregiver. So working all of that out and empowering the caregiver to call the agency back and say, maybe this isn't working. I mean, that's definitely something you can do in your care experience, is ask for a different care provider.
Yes, and I think that point you made, Bonnie, about people being hesitant to reach out for care, we see that so often, and then it gets to the point where the family's in crisis mode, and then they're reaching out, and in those moments, well, everyone is stressed, and so are we making the best decision possible? We hope that we are, but if you're able to start this planning and at least researching earlier in the disease process, that often can be most effective in helping to hopefully prevent that crisis mode down the road, also give family members a break more consistently so that they can continue to provide that care. One of the findings from my research was that family members wish they would have started care sooner. And some couldn't, maybe because of financial reasons, but often they waited because they thought, well, I'll need that more down the road. And so that's why they would often push off the start of care. But after they started it, they said, man, I wish I would have done this sooner. And so I think that is an important piece for families to consider is, when is the right time? And maybe like Ian, your dad wanted to start out with just a couple hours, a couple days a week to try it out, to feel it out, to see what it's like. And I think, especially in the case of someone living with dementia or Alzheimer's disease, it might be easier to kind of introduce someone in smaller chunks and then kind of build again as their needs progress and as they progress through the disease. So those are all such important things to consider. But one barrier that we've mentioned, I think all of us at some point has mentioned cost. Sometimes cost can be a barrier. Unfortunately, home care is not covered by Medicare or Social Security, like a lot of people might assume. And so we find that, paying privately is the most common option for paying for the type of care that is considered home care. So paying out of pocket, privately insured is how some people sometimes refer to it. Other people have, long-term care insurance that they can utilize for this type of service. For those that qualify for Medicaid, each state has its own Medicaid program. And so the qualifications vary state to state, but individuals might qualify for types of home care through the Medicaid waiver program. And then if an individual is a veteran, they might also qualify for services. And I know Home Instead has some great resources on funding care, but also, Bonnie, I know that there are some grant programs that exist. One of them is within your organization. So I'll let you share a little bit about that.
Sure. HFC does have a care grant program, which is in partnership with Home Instead. And you can go on our website and apply for a grant at any time. We offer two kinds of grants. One is an extended relief grant, which provides 25 hours of care per week over a 6-month period. And we also have a respite recharge grant, which is a total of 50 hours to be used within a 3-month time frame. And so you apply, and you can apply, if you are granted a grant, you can reapply to have ongoing care as well. And so there are other grants out there, but we are the largest national provider of free in-home care that we know of. I know Kendra is putting some other resources in the chat. One that we recommend is the ABCs of Respite Care by Arch Respite Care, and that also will provide links to local resources based on your geography.
Thank you for sharing that, Bonnie. Ian, did you have anything else to add from a cost perspective, funding perspective?
Yeah, thank you. I wanted to mention a couple of things, but before I do that, Bonnie, wow, I did not realize your grants are renewable. That is fabulous news. I'm sure it's not new, but news to me. So yeah, everybody call Bonnie. So two other things I wanted to mention, for those that are fortunate enough to have the opportunity to participate in a health savings account through their workplace, often that could be a source of funds to help manage the overall cost of respite services and related services that you may need. And then the other thing, and this, I'm not sure that this is uniformly the case. I can only say in my family's experience, but I think it may be true in some other parts of the country. All parts of the country are covered by what are called area agencies on aging. For my mother, who again did not have cognitive impairment, but had a lot of physical needs related to severe respiratory disease, she did for a period of time have some home care assistance that was organized through the local area agency on aging where she lived. And it was essentially prorated based on financial need. So my parents were fortunate. They didn't need any of the subsidy, but for other people in that community, for whom it would be impossible, frankly, to ever afford professional home care, respite care services, there was a sliding scale, and it could be remarkably affordable, even for very low income families, to get high quality assistance, because the Area Agency on Aging would contract essentially in bulk with a private respite care or home care provider to meet the needs of local residents. And the subsidy was because the Area Agency on Aging was either itself a nonprofit or itself a local arm of government. So in my mom's case, it was the Area Agency on Aging was part of county government human services. In other parts of the country, it's a nonprofit. But there are ways to kind of cobble together resources, regardless of what your level of income or savings may be. Obviously, if you have more personal assets, you have more options, but there should be an option for virtually everyone anywhere in the country, including and especially home instead in so many places that otherwise would be hard to serve and hard to reach.
Thank you so much for adding that, Ian. I think that the local AAAs are an underutilized resource. People don't know that no matter where you live, there is a AAA. Even if you're in a rural community, there's a AAA, Area Agency on Aging, that will have services in your area. And so you can go to US Aging's website. That's kind of the overarching website where you can search by zip code to figure out which area of Agency on Aging services your loved one's area or your area. So definitely some great resources from a financial perspective. And Ian, I like how you kind of use the term cobble together resources, because we do see families utilizing multiple funding streams to help provide this care to their loved ones or to help fund it. And sometimes it's even, various adult children within the family that kind of pull their funds together because, they themselves can't be there 24/7. And so they want that extra support to kind of fill in the gaps where family cannot be there. So there's a lot of ways to fund care. And so I think as families think through those options, you'll start to kind of piece together that puzzle to fund the care that you need and to get the support that you need. And we'll also put the link to the HFC Care Grant, Dementia Care Grant application in the chat so everyone can access that as well. I think it's a great resource. And Bonnie, I know in addition to the grant, HFC, you mentioned the support groups. I'd love for you to share just a little bit more about those, and then also the other resources that HFC has for family caregivers, because I know that you do so much in that space. I'd love to hear more.
Great. Yeah, absolutely. HFC offers online support groups, which we've been offering since the beginning and since before the pandemic. We've been virtual. Primarily because that was the way young people connected when we first started them, but we do have ongoing support groups. We match people based on their personal situation, and we also match them based on whether it's their caregiving for their spouse or caregiving for their parent, or they're a younger caregiver. And those groups generally run for 10-week sessions, but what we found is that the group just keeps going. They are absolutely free, and they are facilitated by a licensed social worker. We have groups that are in Spanish language. We have a group for LGBTQ caregivers, and we have recently launched bereavement support groups both for adult children who have lost a parent or for a spouse that has recently lost somebody. And finally, we've just launched our daily drop-in groups. So those you can just drop in if you're having a day that you need a little bit of extra support. You can pop into that. You don't have to sign up for that ongoing. But again, if you go to our website, you can sign up, and our team will work to match you with the appropriate group. In addition to our those ongoing support groups, we also do a series of caregiver webinars. We've hosted them on improvisation, meditation, movement, as a way to buoy caregivers in their caregiving experience. And we also have launched a large-scale CareCon, which you can also find on our website. That was a 2-hour virtual event. We'll be running another one in February of 2022, which had 4 breakout sessions offering really tangible strategies for caregivers to help them on their caregiving journey. So that's something that can be helpful to caregivers in our audience today.
Thank you so much for sharing that, Bonnie. And I love how you do a CareCon. I think that is a play on words for those that are Comic-Con fans, but I think that is such a great way to bring caregivers together. And I think sometimes caregivers can feel very alone on their caregiving journey. And so to come to those support groups or that drop-in support group, I love how you said to buoy the caregivers, to kind of come alongside them and help sustain them along their journey with the various pieces of advice or just outlets to de-stress and unwind and to share with one another, learn from one another. I think that's so valuable. And I know at Home Instead, we also have some great resources too, homeinstead.com/care resources. We have a fun series of tips videos on Alzheimer's caregiving that we'll be releasing on World Alzheimer's Day. So I encourage you to follow our social media pages for that information, and please search on our site for anything Alzheimer's and dementia related as well. And then Ian, I know people can, sorry, Bonnie, go ahead.
Sorry, I was just going to jump in. Sorry, Ian, I'm monopolizing now. We also, on our website, I just wanted to plug HFC's brain health education resources. We heard from so many caregivers that really are concerned about their own brain health, that they, since there is some genetic link in this disease. And so we do offer brain health information and articles and links to recipes and things like that on our website. So just wanted to make people aware that that was there as well.
Fantastic. And we'll make sure that the HFC website is dropped into the chat box. They also have great social media channels that I follow, and I love following them. It's just such great information, and they keep that flair of humor to it as well. And so I really appreciate that. And then Ian, I know that you have a very active Twitter feed. I was going to share it really quickly so that people could see your feed. Is this the best way for people to follow your work and to keep in touch with you?
Yeah, it is. Most of the work that the LEAD Coalition does is federal public policy. So I think it's sexy work, but for most people, it's a little dry. But for those that would like to be grassroots advocates, honestly, the LEAD Coalition isn't the place to come. It's many of our member organizations. And there's a link to our website on our Twitter page. So you can find groups like HFC and Us Against Alzheimer's and Alzheimer's Foundation of America and so many other groups that do tremendous advocacy work, engaging grassroots, regular members of the general public that have a story to tell and want to make sure that Congress and federal agencies know to do the right thing. So I would encourage people that want to engage in policy to do that. But the Twitter page I do is my way, as someone who's lived this in my own family repeatedly, it's my way to reach out to other families and individuals that are directly affected. And so I try to do that in a lot of ways, because there are 6 million people in this country that have Alzheimer's or another form of dementia. There are over 15 million caregivers. I promise you, no 2 stories are exactly alike. So everyone needs something a little different. But some of what I post on my Twitter page is science information for those that want to delve into that. For other people, it's what I've needed sometimes, which is just a little emotional boost to say, I get that you're hurting. I get that you're lost. You can get through this. Others are getting through it. Others are there to support you. Sometimes it's humor. Sometimes it's videos that are kind of tutorials on how to be a family caregiver. It's lots of different kinds of resources. And part of what I like about Twitter is you can drop in and it's bite-sized. So if someone's got 30 seconds and they can just take their phone out, tap on Twitter, maybe they've got my page bookmarked, maybe something else they find useful, and they can just get that moment of inspiration, that moment of clarity, that one piece of brain health information that they really can act on. And I want to pick up quickly on the brain health point that Bonnie raised. There are genetic links to Alzheimer's disease and other forms of dementia, but the vast majority of people don't get these diseases purely because of genetics. They are not genetically destined and certain. It's the interaction of genetic susceptibility with things in our lives that trigger and accelerate that susceptibility and make it, sadly, come to fruition as something we use this umbrella term dementia for. It's actually any number of individual diseases that share this set of symptoms. But there is so much we can do. I don't ever want anyone to blame themselves or blame anyone else who winds up with one of these diseases, because not all the factors are within our individual control. But the point Bonnie's making, I think, and Bonnie, tell me if I'm wrong, I don't want to put words in your mouth, but there are things we can do to reduce our risk and reduce our susceptibility that are in our individual control. So a healthier diet, a healthier struggling for my words, healthier physical activity, social engagement, intellectual engagement. Those are all really valuable things, in addition to taking care of other related health concerns like managing diabetes, smoking cessation. But there are also things that are systemic and societal, and that's where policy comes into play. We need a better, more vibrant, more democratic, if you will, small d democratic, higher education system. The more education attainment you have in early life, the more protected you are against Alzheimer's disease. If it comes, it will come later and it will come milder. But not everyone has equal access to education, either basic primary education or advanced collegiate education. We need to democratize that. And that's a long-term effort, but it does bend the curve of how many people get Alzheimer's, for how long they have it, and for what degree of intensity they have to endure it. So we have to have these individual interventions around brain health. We also have to have public, broad-based, democratized public health interventions to lift up everybody.
Thank you so much for sharing that, Ian. And I would encourage you all to follow his Twitter feed, because he does put out some really great information. And there is a lot of advocacy work that's happening through these various Alzheimer's and dementia related organizations. And I just want to thank you, Ian, and all of the grassroots efforts that you help to lead, because there are some risk reducing factors that can help prevent or reduce the risk of Alzheimer's disease, and people just need to know about it. And so I thank you both for the work that you do in your respective organizations to share out that information, but to also make it practical and tangible for people. And there are some just little things we can all start to do to take control of our brain health. And so I know that we have covered a lot in this chat, and I know we've talked about home care and the supports and resources that are available, how to pay for home care, some of the benefits, some of the barriers, but hopefully this has been a helpful conversation. We're now going to open it up to the audience for questions. So if you have a question for Bonnie or Ian, or just kind of a general question, something on your mind in relation to home care or to caregiving or to dementia, we're going to try to address as many of those as we can in the last about 10 minutes that we have together today. So if you're on Zoom, feel free to chat in your question in the Q&A box or the chat function. And if you're on Facebook, please go ahead and submit your questions in the comments section below. You know, we do have one question that's come in from Lori. There's been a lot of buzz around this new drug, this Atenbaum drug. I don't even think I'm saying it right still. I've practiced it so many times, but it is a challenging word to say. But there's this new drug that could potentially, slow the progression or to ease the progression of dementia. And so she is wondering, her husband's neurologist says that he's a good candidate and she sees the risks. She's trying to balance the benefits and the risks. And I think that's really been the buzz in the community so far around this drug. So any thoughts for Lori? I guess she doesn't really have a particular question per se, but for those that are trying to weigh the benefits with the risks, what kinds of things do you think they should be thinking through? Ian, I'll start with you.
Okay, sure. So, Lakelyn, I was in your shoes on how to pronounce it. I worked really hard to learn the scientific name, which is aducanumab. And then when the US Food and Drug Administration approved that medication as being safe and effective, then the brand name came out. It's way easier. It's Aduhelm.
Aduhelm. Okay, right. Aduhelm. So I'm going to get it next time.
Say Aduhelm instead of aducanumab. But you're right. I mean, this is not a slam dunk. This is not a cure. The company that makes the drug, the US Food and Drug Administration, they understand and they've tried to be clear with the public. This is not for everyone, and it doesn't end Alzheimer's. But let me tell you my understanding as a layperson. I'm not a doctor, I'm not a scientist, but here's my understanding of what the drug is, what it does, and who it's for. This drug, the evidence that we have through the clinical trials that have been done thus far, does not stop and end Alzheimer's disease. It doesn't cure it. It slows down the rate of progression for people in whom it is effective. The people for whom it is effective, according to the clinical trials, are people either with mild cognitive impairment, people who do not have what we would classically, clinically call dementia. They have something earlier, where they've got some cognitive symptoms, but it's not full-blown dementia. So it's mild cognitive impairment, sometimes called MCI for short, or they have what is being called mild dementia. I would call it very early stage dementia. So limited, mild symptoms are what this is targeting. And it's to slow the rate of decline. It's not to bring people back up into a healthier cognitive space than they were before. It's not going to work for everyone. And there are some safety issues. But the US Food and Drug Administration said safe enough, effective enough to be available for clinicians, for doctors, to discuss with individual families, individual patients, to see if it's a good fit for them. Once you've gotten to that point, I'll tell you what you need to do. You need to make sure you actually have mild cognitive impairment or early or mild dementia due to Alzheimer's disease. There is no evidence based on the clinical trials for any other disease that causes dementia. It might work, it might not for those other things, but the clinical studies that were done were uniquely for people that have mild cognitive impairment or mild dementia due to Alzheimer's disease specifically. So part of what people need to do working with their clinician is verify that the dementia or the mild cognitive impairment is due to Alzheimer's disease, not one of the other literally 100 things, diseases and other health conditions that can result in dementia. Those tests can be done, but they're not inexpensive and they're not covered by Medicare. So it would be a private pay or private insurance decision about whether to cover those tests. The drug itself, Aduhelm, is enormously expensive. The average predicted cost for a person in this country for a year supply of Aduhelm, and it's done by infusion, kind of like some other medical therapies where you have to go to an infusion center and it's applied intravenously. It's not a pill you take. That cost could be as much as an average of $56,000 a year per person. For people that have Medicare, if Medicare decides to cover the drug, most or potentially all of the drug cost will be covered and it won't be out of pocket. For some people, there will be a copay and a substantial copay. For people that have supplementary insurance, there may be no copay at all. And for them, it would just be the cost of the clinical care, the diagnostic work, and maintaining a careful eye on safety for themselves or their loved one as an individual. So the cost can be prohibitive. And part of what we are doing in advocacy, both in terms of advocating to the Medicare agency, but also advocating, frankly, to the drug company that manufactures this drug, is to bring down the cost, to make it affordable. And again, I'm going to use that small d word, democratize access. If this drug works, it needs to be equitably available to everyone, regardless of their personal financial situation, either through the price coming down, through Medicare coverage, through better private insurance coverage. We can't have winners and losers when we have effective therapies. But it's also really important that everyone understands this is the first drug that the FDA has ever approved to modify the course of the disease. There will be more drugs, and as good as this first drug is as a start, it is only a start. There will be better drugs that will be more safe, more effective, more affordable. We just have to start somewhere to get to that second, 5th, 10th, 20th drug. The wonders of cancer care now, cancer clinical care, only happened because we started 50 years ago with the first drugs that weren't as effective as what we have now. We need that. We deserve that. We will have that in Alzheimer's.
Thank you so much, Ian, for breaking that down. I think it can be a confusing conversation when there's, some people for the drug, some people against the drug. And I think you did a great job of kind of laying it all out there. And I think that hopefully Lori has already commented saying thank you. This has been very helpful to her. And Lori, our thoughts are with you as you work through this option with your clinician. And we have time for just one more question. And someone, Betsy is asking what to do if somebody in the middle stages of Alzheimer's says no to bringing in care. I think that we hear that a lot. People are resistant to care. I have a few thoughts, but I wanted to see, Bonnie, do you have any thoughts on that, or if people are hesitant to bring in this type of care?
Yeah, I mean, I'm sure you'll be able to answer it more comprehensively, but the hesitancy can stem from so many reasons. One is just disrupting, what a patient feels is happening in the home daily, what they're comfortable with, but there's also so much shame and secrecy around this disease. And so it could be stemming from that, not wanting to let other people know. And I think that one thing a person can do is reach out for support so that they can get support in helping talk to their loved one about bringing somebody in early. But you're the expert, Lakelyn, so I'll let you take that from here.
I think that you're right. There's often, if someone's being resistant, there's likely a reason behind it. So I think the first thing to do is really to ask the question, what makes you so hesitant? And you might find that it is stigma. You might find that they don't want a stranger in the home, or they themselves don't feel ready for the care. And in those situations, that can be really challenging. And so it might be just having that more open dialogue, might be coming to an agreement of, would you be willing to try it? Kind of like Ian's dad, for a couple of days, for just a few hours to see if you like it. And if you don't like it, if it's making you uncomfortable, we can stop. It's not something that you're committed to for life when you sign up for. Another thing can be, if you as the caregiver truly feel you need this as a respite, explaining that to your loved one. And they might be a little hesitant, but if they know it will help you and provide some relief to you, then they might be open and willing to try it. And so I would say, try to create an open dialogue, try to get to the reasons why the person is so resistant, and then see if you can come to an agreement on at least trying it. And maybe you start by having a family member or friend kind of come over, somebody that they know, to start allowing you as the caregiver a few hours away. And then once they kind of become used to that, then you could look at introducing a professional company in as well. And again, so those are a couple different things you might want to try, or you might approach from those angles. But it's common. So Betsy, know that your situation, you're not alone. We often see that people are hesitant to trying in-home care. But I think we're all out of time. This has been such a great conversation. I could talk to you both for hours about Alzheimer's and home care and respite and brain health. There's so much to this topic, and that's why we create this whole series. So each month we can come back together and discuss another topic related to caregiving. And actually next month, in the month of October, we'll be talking about Parkinson's disease. We often talk about Alzheimer's and dementia, but Parkinson's disease is something that we are seeing more commonly in the aging population. And so we'll be talking with someone from the Davis Phinney Foundation, and we'll have more details on our social media page to come. So stay tuned to our Facebook page. And we also have a great e-newsletter that comes out twice a month, all about Alzheimer's and dementia related topics. So you can also sign up for that on our website, helpforalzheimersfamilies.com. But Ian and Bonnie, I want to thank you both so much for joining me and for sharing about your organizations and your work. For Ian, sharing your personal experience with home care, and Bonnie sharing the experience of the grant recipients of HFC's Dementia Care Grant. So thank you both so much for being here.
Thank you.
Thank you.
And thanks to everyone who joined us today on Facebook and on Zoom. We wish you a wonderful rest of your Wednesday, and we'll see you next month in our next Caregiver Chat. Stay well, take care of yourself while you take care of others. Bye.